Hey, thanks for joining us for today's episode of Feng Shui It. We have an amazing guest with us here today, Christina LeBoeuf, who is an acupuncturist, and she does a lot of other things with acupuncture. So we're excited to share that information with you today. But before we get started, you make sure and hit that subscribe button right here, right here, right here, wherever it's at on your device. Make sure and subscribe so that you never miss an episode of the show. And all of the contact information, if you want more information about today's show, is right down here in the description. You can just click it, or you can check out our website at fengshui-it.com or our Facebook page or on Instagram, all right? So enough about all of that. Let's get started. Christina, thank you so much for coming and talking with us today. So I wanted to first talk to you about what is acupuncture, because as we know, and I talk about it a lot on the show, I live by acupuncture. I love this stuff. I am an acupuncture junkie. And I have lots of friends that kind of scratch their head at me and they go, why in the world would you want to stick needles in you? And they make it sound like it's something painful or something. So before we get started, let's really just give a definition and just a simple explanation of what is acupuncture.
Yeah, a short definition would be it's the practice of inserting fine, hair-like, sterile, one-use needles into specific points on the body to stimulate healing and promote your body's ability to heal itself, essentially.
Right, and this is kind of a notion we talk about a lot on the show, which is the body's ability to heal itself. And this is a common theme with all of the therapies that I talk about on the show, is really relying on this intelligence of the body to be able to heal itself if it's given the proper environment in order to thrive, right?
Exactly, yeah.
And so when we're, and I like the fact that you right up front just talked about these are one-use needles, okay?
Exactly.
You're not boiling them in the bathroom or putting them in hot water, microwaving them. We're not gonna just save some money and keep mine in a bucket and re-stick them in next week, right?
No.
I mean, because people have some really crazy ideas as to what they're thinking we're doing in acupuncture. You take them out, they go straight into one of those little needle things, and like at a doctor's office. But they're not needles like a shot, right? Not only are you using acupuncture, because acupuncture is pretty complicated. I mean, let's face it, you've got some pretty good degrees behind you. You're a certified clinical thermographer, certified lymphatic drainage therapist, a master's degree in Oriental medicine, Bachelor of Health Science, bachelor's degree in environmental science. I mean, and the list goes on, right? So, I mean, this is not like this is just something simple. I can take a weekend workshop to learn how to kind of place some needles and feel good, right? I mean, this is years of studying and a lot of knowledge of Chinese medicine, right?
Exactly.
Right, so you're not only using acupuncture. One of the biggest reason I really wanted you on the show was because you incorporate some other technologies with acupuncture. So we already have the amazing effects of acupuncture in Chinese medicine. Let's tell our audience about what we're using technology-wise.
Yeah, so at the clinic I found that acupuncture, like you said, is amazing. It can heal a lot of different disorders, but it takes time. The effect is cumulative and people are not that patient, and I get it. They've been sick for a long time and they want results right away. So in my frustration, I started searching out ways to make acupuncture work quicker. And I found that electrodermal screening was really important. I used something called the Pointer Excel, and I can put it on acupuncture points, and it measures electrical conductivity. So either the acupuncture point is conducting electricity properly or it's not. And it gives me a dysfunction level 0 to 500. So that helps me narrow down what acupuncture points I'm going to pick. And it's crucial to use that when you're doing ear acupuncture. The points are so close together, almost right on top of each other, in fact, yeah. So it really helps narrow that down for me. And then I found that thermography made a huge difference. I could visualize the meridians. Where was the inflammation? Where was the poor circulation? And so I could get an immediate answer of the whole body instead of using acupuncture screening, which we were just talking about, one point at a time. And then I found that people would hit healing plateaus. And I couldn't figure out why. And when I was doing continuing education for my thermography certification, a doctor in Atlanta told me that lymphatic drainage was key, that people were ignoring the lymphatic system, and that if you could get their immune system working better, cleaned out, I guess you could say, that they would start to heal quicker again and start progressing forward. So I added that to the clinic.
Right.
And then I started researching the Fisher-Wallace device, which is electrodes placed on these acupuncture points here, and it helps stimulate calm relaxation within the brain. So it's highly effective according to double-blind, placebo-controlled studies done by major universities for depression and anxiety.
Right.
And then an infrared sauna for detoxification. I just kept adding therapies so that people would get better twice as fast, sometimes even faster than that.
But I want to back up, because you don't just do the lymphatic drainage. There's something really cool about the way that you do lymphatic drainage. It actually helps kind of speed things up even more than regular lymphatic drainage. Can we talk about it? Is it electric lymphatic drainage? Is that what it is?
Yeah, so it's a medical device. It comes in a case. It has argon, xenon, and krypton gas in glass tubes with ultrasound and microcurrent. So instead of me using my hands to do lymphatic drainage, which is traditionally how it was done, a very gentle massage, gentle because the lymph nodes and vessels are right below the skin surface. If you press too hard, you collapse them, and so you're not actually doing any good. Instead of doing it like that, I use the glass tubes in my hands and I massage lymph nodes and vessels with that device, and then I drag it or sweep it to collection sites, for instance, the underarms. So one session used with this device equals 6 to 8 done by hand. So it's a rapid detoxification.
6 to 8.
Yeah.
That's incredible. Now, do you feel any effects because it's done so fast, or is it just really just more efficient?
You can. There can be a detox reaction, also known as Herxheimer. It's not that common, but for people that are dehydrated or who have never detoxed before or are really sick, they can have a little bit of a reaction, and that just means that their system was unable to flush out the toxins quick enough that we released. And so I recommend Epsom salt baths and maybe a sauna, and of course a lot of hydration.
But this isn't like something that most people are going to experience.
It's really uncommon. It can happen. It's just uncommon.
Right.
I usually tell my patients that it's possible, and then I really recommend they start drinking a lot of water as soon as they leave the office.
Right, just to help your body to naturally get rid of the waste. So what can acupuncture be used to treat? Let's get back to acupuncture. So what kind of illnesses or issues or things that can we work on with acupuncture?
Well, Chinese medicine is a complete healthcare system, so it helps restore our balance, so therefore it treats everything pretty much. I mean, we don't set bones if they're broken, but we certainly, once they're set, help you heal them quicker.
Right.
So the National Institute of Health and the World Health Organization put a list together of over 40 different illnesses: allergies, asthma, arthritis, migraines, infertility, constipation, healing injuries, anxiety, stress. I mean, it just goes on and on.
The list goes on, yeah. I mean, there's a lot of things. One of the questions that I have people ask me a lot is acupuncture painful? And I kind of chuckle, because sometimes the needles are a little bit uncomfortable because I've got a major issue going on at that point, and I need it to feel uncomfortable so we can release that. But as a whole, is acupuncture painful?
I wouldn't say so. The needles are literally the size of the hair. For people that know a little bit about wires, it's a 40 gauge. It's really small. They're laser cut, so they insert painlessly for the most part. Like you said, once in a while we're really close to a nerve, and we're doing that on purpose, of course. Yeah, so I usually let my patients know this one might feel a little swollen or a little achy or a little distended, and only lasts for a few seconds. And we're achieving a little something extra with that, and so that they're not caught off guard.
Yeah, and I think that's the big picture that I want to really drive home to our audience, is that although you may feel the discomfort in that particular space because maybe I'm having gallbladder issues or liver issues or whatever, just a torn ligament that's healing that's a little bit uncomfortable, the pain happens and it kind of goes. It's not like stumping your toe and your toe still hurts 30 minutes later. No. That's not the kind of pain we're talking about. Or it's not like sticking your finger with a staple or a paper cut. It's nothing like that. It's just a little bit uncomfortable, like, oh, I can feel that there's something wrong there. And it's that intelligence of the body communicating with itself, saying, see, I told you something was wrong here, right? It's kind of validation.
Exactly.
Is how I see it. Yeah. So does the skin need to be cleaned in a specific way prior to acupuncture? Like, do I need to use a special cleanser to come to acupuncture, or maybe not put lotion on that day? I mean, how do we prepare for an acupuncture treatment?
Yeah, people who have come to me right out of work from construction sites, and they're filthy when they get there. It's not a big deal. I thoroughly cleanse the area with 90% isopropyl alcohol before every needle.
Okay, all right.
Yeah.
So we don't have to worry about any type of infection or anything like that.
Mm-mm.
How long is an acupuncture session? So after we get all these needles put in the various places for whatever my concern is, how long am I going to lay there on the table? Because again, when you're doing acupuncture, you lay on the table and get the needles inserted. So how long do I need to lay there? Am I going to be there for hours or?
That's a great question. Yeah, so it depends. Some patients come in with maybe having a panic attack at that moment. And so I may leave the needles in for half an hour, 45 minutes. It could be a child who's on my table who's 5 years old and I'm just treating attention deficit. I might leave those needles in for 5 minutes. In fact, the patient has, once they've been to me several times, they usually give me an idea like, oh, 15 minutes is the sweet spot for me. So it varies, but I would say somewhere between 15 minutes and half an hour is usually how long I leave them.
And how long, or I should say, how many sessions should I expect to go to an acupuncture treatment or a session for whatever my issue is? Is it going to vary, or is it kind of like 5 treatments and you should be good?
Yeah, that is something that everyone always asks me. A full course is 10 treatments, of course, and this is an international protocol. We also have a protocol internationally that if in 4 treatments you see very little results, then either it's not going to work good for you or it's going to take a very long time to work good for you. So I always tell my patients, give me 4 visits and I'll let you know. Maybe you need 5 more, maybe you need 2 more, but I have been pleasantly surprised many times by somebody who quit smoking after 1 treatment, or their sciatica went away after 1 treatment, and we're all just grateful. And
you're mentioning some pretty big things to treat with acupuncture, things that most people probably would not think about as traditional forms of treatment. I mean, you're talking about quitting smoking, something that people take years to do sometimes.
Yeah.
ADHD. I mean, this is something that's an epidemic really in our country now, that we just kind of drug, these poor children that are developing bodies to override their systems. And you're telling me with acupuncture, in many cases, we can relieve the symptomology of ADHD.
Well, I'm also combining other therapies. I'm using thermography. Sometimes often if you feed certain foods to a person and use thermography, you can see what they're allergic to, and the allergies cause inflammation in the digestive tract, which affects the brain. So I'm often looking for food allergies with ADHD. I might use the Fisher-Wallace device also to help calm the brain waves. So food, diet, I'm combining a whole bunch of things. But yes, acupuncture with all the therapies that I've been learning over the last 20 years. Okay. That is something treatable.
Right, and then that's segueing into our next question about thermography. You were saying you use that. Now, I came to see you, and we did a thermography session, and I was blown away. I mean, I thought it was the coolest thing in the world. I called everybody I knew after the session, was like, oh my gosh, this was absolutely amazing. So let's talk about thermography. What exactly is thermography?
So thermography, I use a medical imaging camera, and it measures the infrared radiation being emitted from your skin surface and then converts that into electrical impulses that I can see in color on my computer screen. And it has a really high sensitivity to changes, pathological changes in your vascular system, so that your veins and arteries, and your neural system, your nerves, and your muscles and your bones.
Right. So how does thermography help you to enhance acupuncture? Because you've kind of touched on that a little bit earlier. So you take a scan in the beginning when a patient comes in, and what does that scan tell you? So if you see what do you do? What do you do with this? How do these two things combine?
Well, it's letting me look at the acupuncture points, actually visually see what's going on in that area. Is there too much inflammation? Is there no circulation at all? I had a patient in the other day who had a stroke a year ago, and I was just doing breast imaging on her, but I could see when I did her back image as a complementary image that the left side from her shoulder blade all the way into the arm and down had no circulation practically. Oh, wow. So I could see where the stroke had cut off
blood flow, right?
Yeah, blood flow and nerve signal from that body part to the brain. So I sent those images along with her so that she can bring that to her acupuncturist, and now they can treat that area very specifically, where before they're just following protocol, which is good, but I'm talking about getting great results.
Instantly.
Yeah,
Like
instant
science.
information.
Just
Yeah.
plain old facts. Look at it, here it is, we can work with these points. How early can thermography detect issues? Because when I came to my session, we talked about some issues that thermography could actually give me some information pretty quickly, pretty early, earlier than even some blood work can show. So let's talk about that. How early can thermography give us that feedback?
Yeah, so I am continually surprised at how early. We have studies showing that it can find breast cancer 10 years before any other exam. And the reason is that breast cancer starts out as an area of inflammation with increased blood flow. That's not something that you can see on an x-ray or a mammogram, but we can see with thermography. And so we can track that, either progression or regression of that inflammation and increased blood flow. So sometimes as much as 10 years. With other things, for instance, diabetes, we'll see when we do the image of the hands that it looks like they're wearing dark orange gloves in the image. And that, again, will say to me that they're developing diabetes, even if it doesn't show up on the hemoglobin A1C, which is a really specific test for blood sugar issues over many months. And this could be years, if maybe longer, you know, that they develop diabetes. But the way I deal with it is treat it now. Like, I know this is coming, I can see this is coming, let's fix it. And then I use thermography to monitor the progression. You know, are they getting better? If not, thermography tells me, and I change the therapy.
Right, and so we're not really saying, like with the example with being able to detect breast cancer, we're not saying don't do mammograms, do this instead. What we're saying is this is another tool in your box that can help to give you a better, paint your picture a little bit quicker, that we can get this feedback and information. So for someone who may be in their 30s, who don't quite qualify for their insurance plan or medical care to go ahead and start paying for those mammograms now, thermography is something that they can use now at 25, 18, 17, you know, and look and see if we have any of that inflammation starting to occur. So it's just a tool that we can use amongst, still do your mammograms, still do all this other stuff, but this thermography is really giving us some quick feedback about how to provide prevention instead of just reactive medical care, right?
Yeah, and they found in recent studies that if you combine mammography with thermography, you have a 95% chance of detecting early breast cancers, which that's huge.
That's incredible. Christina, let's talk about some real images, okay? So I have to tell you, I was quite shocked when I came to your clinic to do my thermography. I was expecting this big X-ray, CAT scan, MRI kind of thing, you know, this big monstrous piece of machinery, and it was a camera. Yeah, it was a camera, and it was really interesting because when you did my first images, we were able to find some pretty good areas of inflammation. And let's show the footage. We've got a picture of this thermography machine in the clinic, right? And as you can see, it's really small. The clinic, the acupuncture table is there. You can do everything in this one area and get it done. Yeah, so you know, this is not intimidating at all, because I was a little bit intimidated thinking thermography, like that sounds super, you know, ooh, scary, intimidating, and it wasn't. So you've got a couple of scans that you've brought for us to take a look at and talk about. So let's put up the first image.
So the first image that I brought is of a patient of mine that had fibrocystic breast disease. So that breasts are lumpy, they're sore, they're worse with hormonal fluctuations and caffeine use. And so we did a scan, and then I had them use Renew 28, which is a redox gel.
And we're going to get to that, because I'm looking at this picture, and I see lots of reds and orange and yellows, and they're kind of blotchy.
Right. Yeah. So red, white, and orange are areas of inflammation.
Okay.
Yeah. And so we're trying to diminish that any way we can with acupuncture herbs, whatever we use. Yeah, and so in this case, we were testing the effectiveness of the redox gel, Renew 28. And so we put one application on both breasts. We waited 10 minutes or actually in this case, 13 minutes for the body to acclimate and for the redox gel to do its job. And then we took a follow-up image, and so that's what I'm demonstrating here, how much inflammation.
And that's incredible. I mean, the yellow and the orange is pretty much gone now. I mean, of course, under the breast, because it's hot, it's just the natural heat from
the
breast.
Skin touching the
right,
skin.
skin touching
yeah.
skin. So that's not what we're looking at. We're looking at the actual, this yellow and orange area, and it goes almost completely away. It's just barely yellow.
Yeah.
Little bit of green and blue back. And this is from a redox gel, you're saying. So let's talk about that. What is this redox gel doing? Because you're saying it's working. So what is it, just removing the inflammation, or how does this product work?
Yeah, so redox stands for reductant and oxidant. And when it comes in contact with the skin, it immediately goes into the bloodstream. And it tells the immune system to find and either repair or replace broken cells. It doesn't matter why they're broken or where they're broken. It could be over your pancreas, it could be over your thyroid, it could be wrinkles on your skin, it could be cellulite. This is all comes down to broken cells. So that's what it does. It also boosts glutathione by 500%, which means your body detoxifies. It's your body's main antioxidant made in the liver.
So just by applying this cream to the skin, it soaks in?
Into the bloodstream immediately. Instantly. Yeah.
Okay. So is it only a gel, or are there other products in this line, or can I drink the gel, or how does that work?
Yeah, no, I'd love to drink the gel, but they do have a drink called Acia, which is the first product they created, the first product they stabilized the redox molecules in, bioactive form, which is identical to what your body makes. You can't be allergic, it's impossible. So yes, they have a drink, it's only 2 ounces twice a day, and so you heal from the inside out, and the gel you heal from the outside in.
Okay. So are there any limitations? So if I have maybe hypertension or diabetes, is this going to affect any of these illnesses? And you said I can't be allergic to it.
You can't.
But will it affect my hypertension, my blood pressure, or my blood sugar?
Yeah, that's a good question. When I first found out about the product, I said, can someone be allergic? Can there be contraindications? What's the deal? And they said that the pharmaceutical company that was planning on buying the patent did all the studies and found that there was no lethal dose 50. None. So there is no way you could take enough of this to hurt anybody, not even your cat, not your hamster, not your baby.
So my dog could drink this?
Yeah.
Really? Are there any studies showing about animals with
Yes,
this?
there are a ton of studies.
Really?
Yes, and I have some really great pictures of horses that have injured themselves, cut themselves open really bad and needed stitches, and we used the gel and it healed it twice as fast.
So you mentioned that this was put on the horse, that it cut itself. So can I put this on an open scrape or an open wound? I mean, obviously I'm not gonna, go to surgery and just slap some of this on the inside of my surgical wound. But I would imagine, little scrapes. I have a son, and he falls, and scrapes his leg. I could just put some of this on it like any other type of first aid cream, and it would help to heal it just as quickly.
I have seen amazing results, things that I can't even describe had I not had the person right in front of me. I've used it on all kinds of skin conditions, the one that creates the white scaly rash, the one that has the itchy bubbles. I'm really not allowed to say technically the scientific name for these disorders, as the company would rather I not stick to medical terms. But I think you guys know what I'm talking about. Also, I've used it on the blisters that appear in the skin when you have that virus and it causes the pain, which virus I'm talking about.
Yeah, sure.
Yeah, and that got rid of that in 5 days, whereas acupuncture and herbs takes at least a couple weeks. I know they have antiviral drugs for that, but this works amazing. I used it on a dog that got a spider bite. Oh, wow. And it was causing the flesh to slough off, which spider I'm talking about, and it healed that as well. So I've tried on a whole bunch of really amazing.
Sure. I received the treatment in your clinic with doing the thermography scan and using the gel that you're referring to, and it helped me. Okay. What role does nutrition play with all of these treatments?
For me, I tell all my patients that nutrition is foundational.
Yeah, you're big on nutrition. You're really big on that as being the kind of the foundation of of building health. So.
Yeah, and even in Chinese medicine, we believe if you don't fix digestion and assimilation of nutrients first, then all the other therapies won't work, or they won't work as well as they should. So, and it's the same thing when I prescribe ASEA or Renew 28. It stimulates your body to make new cells, or replace them if they can. And so what do you want to make those new cells with? Do you want to make them with a burger and fries, or do you want to make them with orange juice and eggs? So it's just common sense. You're going to make new cells. You have to make new cells. Let's make them with quality food, good nutrition.
That makes total sense. All right. Christina, thank you so much for coming in and talking and sharing this information with us today about thermography and acupuncture, and of course the Renew 28 gel. If you would like information about Christina's services or the Renew 28 gel, you can check out her information. There's a link on our website and at fengshui-it.com. And make sure and stay tuned because your DIY design innovation tip is coming up next.